checking for precautions before I go into the patient's room. I'm going to gel in. And put my gloves on. Been called for a patient assessment because patient is having difficulty breathing today. Alright. Hello, my name's Melinda. I'm with Respiratory Therapy. I'm here to assess you. Can you tell me your name and your date of birth, please?
Rachel Atkinson, 9/10/97.
Alright, thank you. How are you feeling today?
I can't breathe.
Put this pulse oximeter on you. Alright, I'm checking the patient for any diaphoresis, nasal flaring, oral cyanosis. I see some nasal flaring. She's tripoding, using accessory muscles to try to breathe better. Some tracheal tugging. Alright, next I will be checking your midline to see if it's shifted at all. Feels good. And any JVD? Nope. Check for any subcutaneous emphysema. I'm not feeling any crackles. Alright, now I'm going to check your breath sounds. So here, take a nice deep breath in for me, please. I'll check your heart sounds. Rhythm sounds good. Here. Now I'm going to listen to the breathing sounds in your back. Now I'm going to listen to the your stomach sounds real quick. Make sure everything's normal. Right. I'm going to look to see if you're breathing bilaterally. Seems good. We'll check to see if you have any edema in your legs and feet. No? And may I see your hands? Check for capillary refill. Normal, no digital clubbing. Your oxygen is a little low and your heart rate is high, so I'm going to get you started on a nasal cannula. Some oxygen at 2 liters per minute. Here. It's going to be a little uncomfortable. I'm going to check your pulse just to make sure the pulse ox is working and temperature. Alright, we'll take your blood pressure real quick here. Can relax your arm. All right. pressure was a little bit high, but not dangerous. 130/70. Alright, now I'm going to be getting an x-ray taken of you and an ABG, and we're gonna see where your levels are at. I'll come back with some medication from the doctor. Alright, do you need anything else before I go?
I'm gonna have to wear those.
For as long as you're here. Alright, so this is the patient x-ray. We see the diaphragm is depressed, the lung fields are more translucent than they should be, which means there is a significant amount of air trapping and hyperinflation. Patient ABG turned out to be alveolar hyperventilation with mild hypoxemia. The pH was higher than normal, CO2 is lower, and the bicarbonate levels are lower, and the oxygen levels are also low. The patient was diagnosed with step 3 asthma, and GINA standards for step 3 asthma is to send home the patient with inhaled corticosteroid with a LABA. So we'll use Advair discus and a short-acting beta agonist. And for this patient, she'll use ProAir, which is albuterol. Right. Hi, Rachel. Well, the doctor has ordered a small volume nebulizer for you for now before you go home. He prescribed Duo-Neb, which is a combination of Atropine and albuterol.
Cool.
Alright, we're going to use this breath-actuated nebulizer for you today. Make it a little less wasteful. I'll open this cap up here and put the medication in. Alright, and plug it into our air compressor here. Alright. You just put your mouth around the mouthpiece there and breathe in the medication. It'll be for 10 minutes. Breathe slowly and evenly. In and out, deep breaths. Want to get as much of the medication into your lungs as possible. Alright. You're good. 10 minutes passed.
Yeah, that was the fastest 10 minutes of my life.
Alright. Now I'm going to reassess you to see if it has had any effect on your lungs. I'll do some listen to your breath sounds real quick. Lower lungs. Listen to your back real quick. Alright. Sounding a lot better than before. Less wheezes. We'll check your oxygen saturation real quick. Nice. That's looking good. Much more normal. And the doctor wants to send you home with Advair discus, which is an inhaled medication, dry powder, corticosteroid, and a LAVA. Then he wants to send you home with some albuterol, which is a rescue drug. You'll take it whenever you have an exacerbation again.
Okay.
We can also take you off the oxygen for now. You don't.
Nose.